plays genetics or overuse?
Thank you. The age-altered biology, tendon hypervascularity, smoking habit, tendon overloading and overuse are usually accepted as intrinsic factors for rotator cuff tendinopathy. Tendinopathy related to distinct anatomical variants of the scapular shape as considered to be due to extrinsic factors. In absence of a rotator cuff tear, the narrowing of the subacromial space may be the consequence of these conditions. Literature includes a huge number of articles regarding shape, slope of the acromion, acromion index, or a degree of acromial coverage. However, even today, it is unclear if the subacromial space width is primarily genetically determined or changes over time according to the different loads to which the shoulder is subjected. And to clarify these unresolved questions, we compare the subacromial space width between elderly monozygotic and dizygotic twins, and we use the twin study design to separate the contributions of shared and unique environments. So we selected 50 pairs of twins from the Italian twin register, and we selected only the twin whose age was similar to that of patients who were submitted to a rotator cuff repair. And these are our exclusion criteria, obviously the opposite sex dizygotic twin pairs. The acromion distance, the cuff status of the dominant shoulder were assessed by MRI, and the distance was measured by 3 different physicians in a blinded fashion to assess the inter-rater reliability. And it was measured on the coronal oblique projection and considered as the distance between the most caudal point of the lower surface of the acromion and the most cranial point of the proximal aspect of the humerus. All the twins were interviewed regarding their employments and recording information, specific information on both type and duration. And so we distinguished 3 categories: the heavy manual workers, the administrative support workers, and the professional workers. Data were submitted to a very, very sophisticated statistical analysis, and it considered hereditary factors and shared and unique environmental factors. So, 29 pairs of twins from the 50 met the inclusion criteria and were analyzed. 15 were monozygotic twin pairs and 14 dizygotic twin pairs. The mean of the 3 acromion distance measurements was 10.13 millimeters in monozygotic twin pairs and 9.69 millimeters in dizygotic twin pairs. The intraclass correlation coefficients for the acromion distance was I for monozygotic twins, and it indicating a high degree of concordance for the acromion distance in subjects who shared 100% of their genes, while the correlation was low for dizygotic twins, indicating a low degree of concordance for the acromion distance in subjects who shared an average of 50% of their genes. And in accordance with that results, the calculated irritability index was 0.82, while the contributions of shared and unique environments were both 0.09. The role of genetic factors was supported by the results of acromion distance comparisons, and no significant difference emerged between the three groups of workers who had performed different works. And it was confirmed both in the whole study cohort and within the monozygotic and dizygotic twin pairs. Heritability index showed that genetic factors may be considered as the main cause of the variability of the acromial distance, with shared and unique environmental factor contributing only slight to the variability. Our study shows that anatomical features that influence the width of the subacromial space are mainly genetically determined. However, if a patient has a constitutionally narrow space, the external factors would strongly contribute to reduction of this space. Our conclusion: the acromial distance is primarily genetically determined and is less influenced by external factors. Thank you very much for your attention.
So, any questions from the audience? If not, we can go to save time because we are a little bit late. Thank you.
Congratulations, it's an amazing study.